You know you want to do something. I would say start with your skin. Start with a good skincare.
We don't necessarily have to have a 12-step routine, but there's nothing wrong with that either.
Welcome to Big Butts No Lies. I'm Mavi, your go-to guide for everything plastic surgery. With 18 years in the industry working alongside top board-certified plastic surgeons, I know what really goes down: the good, the bad, and the botched. Now I work for you, bringing you real, unbiased info to help you make the best choices for your dream look. Whether you're going for subtle enhancements or a full on transformation, I'm here to give you the facts, the tips, and the confidence to navigate your surgery journey. Let's get into it. Should be fun. Hey guys, do I have the show for you today? I'm super excited to have one of my very good friends, and you guys are in for a treat. Today, we get to talk to Julie Lorenzo out of Florida all about being a nurse injector and what does that mean? Thank you for being on the show, Julie.
Thank you so much for having me, Mavi. I'm excited to be here.
Yay! Julie, I have been following you on social media for years now, and I've watched your evolution. I want us to take the opportunity today to educate my girls. I want you to teach my girls about all of the ins and outs of cosmetics, facial cosmetics. And I know on your guest form, you said something that was really powerful, which was, I stick to the tried and true. And I love that. So I really want you to go into it today with teach my girls what they need to know. Pretend you have them in your chair and you're talking about the tried and true. So tell us, what does that even mean?
So, for me, Mavi, especially starting my own practice, I really wanted to be lean and mean. I wanted to do things that I know were safe, effective, and also didn't cost me an arm and a leg, especially starting out. Unfortunately, I'm not a trust fund baby, so we didn't have a bunch of money just to kind of go into things. So, I really didn't want to get into lasers and things that cost a lot of money and really have a lot of downtime. But the awesome thing about this field in particular is we have beautiful treatments with less downtime, less risk, and sometimes financially, less cost too. So for me, the tried and true is lean and mean your basics, talking about neuromodulators, whatever brand of choice that you like, your basic HA fillers, maybe throw a little bit of Sculptra in there. And then for your skin, really lovely medical grade products and microneedling. That's kind of my mean and lean service offerings that I have right now. I think all of them are extremely safe, very, very effective, but they're kind of just your tried and true treatments.
Absolutely. I 100% agree with you. I love the tried and true. Let's go back a little bit because I really want my girls to get to know you. So tell us a little bit more about yourself and also your journey to becoming a nurse practitioner.
Awesome. So I was a baby nurse many, many years ago. I graduated RN school and worked in trauma actually for about 4 years. Very, very different environment. And I got a little bit burnt out. It was, high stakes, a lot of pressure. It became a little bit hardened and knew that this wasn't something that I could stay in forever. And I had a lovely nurse practitioner that I worked with that did a little bit of Botox on the side. She loved it. I was super interested. And I got to see a lot of facial aesthetics, believe it or not, in trauma from patients that had injuries, car accidents, abrasions, all kinds of crazy things. And the plastic surgeons would actually come in sometimes and even do procedures at the bedside, stitches or different things on the face. And I loved seeing that and seeing how meticulous they were and how rewarding it was for the patients. And so I told myself that I was going to go back to school, and this was it for me. This was what I wanted to do. There was no plan B. I said, I'm going to do aesthetics. And, a decade later, here we are.
Oh, I love to hear that. I love to hear that. So, from being an RN, you decided to be a nurse practitioner. And then after that, you opened your own practice How has it been for you opening your own practice?
Change when the owners changed and things kind of started to go downhill. I think that I hit a ceiling a few years ago within the practice, and I felt myself having to kind of shrink to fit. And so I started to have the realization that in order for me to continue to grow, I was going to have to make a change. And throughout those 10 years, I sought out other opportunities. I had many people approach me, different interviews, wonderful opportunities, but nothing really felt like it was organic for me and that I could practice the way that I wanted to. So I think after about a decade of searching, I realized that I was going to have to build it myself. And so I opened about mid July, and I've been on my own here since September. So we are new, but we are thriving, and I've been able to pay myself, and it's been really, really wonderful, and I'm much happier.
Wonderful. I love to hear that. And it makes me so happy for you.
Thank
So,
you.
you just said something that I immediately knew exactly what you meant, but maybe our audience doesn't know. Maybe my girls don't know, which is the laser cemetery, the machines that, end up in the back room collecting dust, $100,000 machines, $80,000 machines that are in the back collecting dust. Tell us a little bit about how that is or how you see that.
I think that reps, and no hate to the reps, they're just doing their jobs. But I think the companies, have wonderful before and afters. I think that they promise the world sometimes. Most of my experiences are that the pictures are too good to be true. And when we kind of get our hands on them and we start doing the treatments, either the risk isn't worth the reward or we never really get the reward, and we just really don't see the outcome that we were promised. And so you have to be very, very careful, not just as providers, but as patients in what you're putting your money into, because sometimes I don't think they work.
So we know. We know. A lot of these machines, at least from my experience, their promises lift, tighten, make pretty much disappear, make everything so much better. Miracle machines, they lift and tighten without surgery, right?
Yep.
But what do we know? The only way to lift and tighten
Surgery.
is with surgery.
I tell my girls it's time.
So, okay, that's such a wonderful way to lead into that because I'm sure you've seen women of all walks of life, ages, ethnicities in your chair. And how do these conversations usually go for you? Because we all want tight, lifted, beautiful, glowing skin, but sometimes we're past that, right? When they're sitting in your chair for the first time saying, "Give me some Botox," but really they're past Botox or past filler.
Yes, 100%. So anybody can produce a result, right? But not everybody can give you authenticity and honesty. And that's something that I really pride myself in. I have patients that come back to me years later that I never touched. We just had a consultation, but they'll come back to me and they'll say, I came in for X, Y, and Z, and you told me no, and you wouldn't treat me, and you recommended something else, probably something surgical, and they'll maybe have those treatments, but they'll remember that I was honest, and they come back to see me so much later. So for me, it's really not about the bottom line, it's not about the dollar. I'm always going to offer my honest opinion because I want patients to get the best result, and sometimes that's not with me.
Yeah, absolutely. So when somebody sits in your chair, what are the complaints that you hear the most?
Oh, always the jowls. We hate our jowls. We hate our sagging eyes, lines, wrinkles, the neck, the dreaded neck. I would say those are kind of the common things, and a lot of them I can help and I can correct. And then a lot of other things, we have that conversation of, okay, well, this is something that I can't do. So we're going to talk about the limitations of that. And this is what I can do. I really honestly sometimes under promise. I almost try to talk patients out of treatment sometimes because I want them to fully understand the risks and the expectations. And if you are not satisfied with the treatment that I did, then I didn't do my job. So I almost talk patients out of things prior to doing them so that they really understand what I can and can't do, because if you're expecting something that I can't deliver, then you're not going to be happy, and neither am I.
And you know what? I feel like with social media and just online activity, the expectations of what can be done non-surgically are very, very, very high.
Yes.
How do you see that present in your chair?
That's hard, especially if they're new to me, because you can see there's a lot of fluff, there's a lot of smoke and mirrors, especially on Instagram. There's a lot of filtering, there's a lot. And so I really try to kind of redirect, and I will show them sometimes my own before and afters, or before and afters of my patients, and really just try to refocus them on their own faces and what I can do in a way that makes sense to them, and not really look at comparisons of other people. They're never going to get the result of the celebrity that's had, two facelifts already, and they're filtered on the red carpet. So we really have to kind of hone it in and understand that everyone's going to look good on social media. That's kind of the point of it. But what can we do to make you happy looking in the mirror, and try to not compare to what we're seeing online?
Absolutely. I recently had an encounter. I met somebody that I had only known online, and I met her in person earlier in the year. And I was just so shocked at how different she looked in person. I really was shocked. And then I found out that she uses a photo editing apps for anything that she posts online. And at that time, I was like, oh my God, like, wow, you look really different than what I thought you were going to look like. And it made me think, because you and I were having this conversation offline about how I'll take pictures, I'll take a video, and I'm not crazy about how I look, so I don't post it. I'm just,
Right.
I'll leave it to the side, and then later on I'll come back to it and be like, oh my God, why didn't I post that? Like, I like it. And it's because I have these like expectations, especially because I work in plastic surgery, of like, I want to look as good as I can, but also, you guys, I do not edit my photos. What you see is what you get. What you see in my videos is me. Like, they're not edited. I'm not face tuning. This is me. This is me. I'm You get what you get. I want you guys also. I had somebody tell me, "Oh, what did she said something along the lines of like me changing my face or having surgery on my face." And it was like about my cheeks. If I wanted to get my cheeks, like my buccal fat, so why don't
Removed.
I it was more like, why don't you do your buccal fat? And I thought to myself, like, my cheeks have been a part of my identity my whole life. I've always
Aw.
had these big cheeks. I've always had this. So I want to tell you guys that you don't have to change your face to meet expectations or what people look like online. You can authentically be
Amen.
yourself and love yourself. I love my cheeks. I love my face. Although I will say, I'll have a facelift eventually, but I love my face, and I want you to love your face too.
Amen. And I think that's the part that a lot of time is missing in aesthetics. I think so many people try to change the face and do cookie cutter injections and get everybody that same kind of stereotypical facial shape that you see. And that everything that you said aligns 100% with how I feel and how I treat my patients in my practice. Is it's not to change your face. We can do things to keep you refreshed and to try to prolong that interim before you have a facelift, but we keep you, and we keep those things that maybe even highlight those things that you love about yourself, and don't feel like you have to fit some type of prototype and look like this AI chatbot. We can all look like ourselves, and you still want to look like your family too. I think
Yeah,
you want
absolutely.
to fit.
I didn't even think about that. So true.
It's true. You want to kind of look like you belong and not become this morphed feature that doesn't look like everybody that you're around and love.
Exactly. It reminds me of what I've seen recently about Instagram face and how so many
Mm.
influencers or people who are online, chronically online, that they kind of look like each other. They've all started to look like each other, the bone structure
Yes.
and the shape of their face and the shape of their eyes. And it's almost identical, just in different hair colors, different makeups, different, but they're starting to look alike.
Yes. Yes. It's kind of crazy.
Have you had patients in your chair who are showing you a photo of an AI generated picture and they're like, I want to look like this?
I don't know that it's been AI generated, but definitely a lot of the celebrities, which are filtered and face tuned and not realistic. So I kind of just bring them down and tell them, like, I can make you look like that on Instagram. I can show you the apps. We can get you the lighting. Like, absolutely, we can do that. But in real life, let's go to some of those Instagram accounts that show you real with the pores and the texture on the face, and let's go and kind of like talk about reality, because those pictures are not. I want to look like that too. But
We
that's
all
not real. That's not reality. We're not going to walk around with the lighting that I have today and our makeup fully done and our hair fresh and blown out. It's just not real. But what we can do, really, here's my expectations and what you can expect with these treatments.
So that I love that conversation, and I want us to teach my girls about the tried and true. So what do we know the tried and true treatments that help you feel refreshed, that refresh your face? What are they?
Botox, neuromodulators. I mean, nothing ever is going to replace that. I think that kind of, I call that the gateway drug for my field. People are very afraid, especially in South Florida. I think where you are too, but South Florida is the Wild West here. So there's a lot of overfilled faces, there's a lot of pillow face, there's a lot of duck lips. And I think there's still a lot of stereotypes. And patients tell me, their husbands or their significant others, everybody's afraid of them getting work done because they don't want them to look fake and artificial. So I can usually kind of warm you up with neuromodulators and soften the expressions, the wrinkles at rest, but again, artfully. My goal is never for you to be frozen. I don't want you to have zero expression. You want to still move your face, but we can definitely soften those lines and wrinkles. Once I've kind of started patients on that regimen, they're ready. They trust me. They see that they look natural. No one should know that you've done something. What I tell my patients is people that see you after are going to say, like, gosh, Mavi, did you come back from vacation? Like, what's different? Why do you look so good? You look so refreshed. That's what we're going for. Not different, just lifted. Your eyes are more open. You just look soft, elegant. And then we delve into fillers. And when they are done artfully, again, you don't notice it. You don't have to have big, crazy cheeks and overfilled lips and a witch chin and all of these scary things you see on Instagram. But again, it's kind of just chasing shadows and replacing with light and volume. One of my favorite things is the lower face, doing this chin shadow area. We never know that we need it. And then once I've done it on a patient, they're like, oh my God, they can't live without it. They're every time again. Look less, of that resting bitch face, for lack of, look fresh. Everything's just, I like to call it kind of photoshopped almost. You just have that airbrushed appearance where no one knows that you've got filler sitting here, but you just look softer, more approachable. It gives you that extra boost of confidence. Then when we're ready, we layer in a little bit of Sculptra, if you're young and not considering a facelift, and we can really help to, again, elegantly, no one can see. We just fill in these areas. We kind of help lift everything. And microneedling then keeps the skin, giving you that glass skin, and your pores look better and you just look beautiful and natural, and gives you that extra confidence.
I just recently had my lower face. I had 1 cc to my chin
Mm-hmm.
and 2 cc's to my folds here. I was starting to notice it and it was starting to bother me, and I was like, I know exactly what I need to do. And sure enough, I went and I did it, and I'm never going back. Y'all, get
Yes.
used to this.
You see, and no one would know because it just looks polished and beautiful, and it's complete. And that's what it's all about. Not just doing, we start to look weird when we're only doing the face or we're only doing one area. You need to do really full facial balancing and focus on the areas that are lacking and have those shadows and those missing pieces, and then you never look done. That's kind of the art to it.
I think you just said a key word there, which is facial balancing. I know it's one of the most favorite words to find online for facial filler, but what does it mean specifically, like to you, when you are looking at somebody and you're like, this person needs facial balancing? What does that mean for our listeners who might be looking in the mirror right now and they're wondering, do I need facial balancing?
I would say just about everybody could use it, typically, unless you've been getting a lot of fillers. But I mean, as soon as our 20s, we start to have volume loss. So sometimes that's cheeks, and it's going to be different for each individual, depending on where you start to lose volume. Have you had dramatic weight gain or weight loss? That's all going to affect the fat compartments in your face and where we're seeing volume loss. So for some, that could be the cheeks. Maybe they're complaining about their under eyes, but their cheeks right here in the mid are so hollow that that's actually what they're noticing and why they look tired. So that could be an area that you need some volume. Sometimes it's the temples. We start to get that peanut head that you don't know why you're looking off, but that lack there is affecting everything else. The classic is the patient that comes in for the lip filler, but meanwhile, everything here is caving in. They have no chin. If you give that girl big lips, it's going to look noticeable. And that's where maybe she looks like she has the duck lips. Versus if you add the chin, you add the little bit of chin shadow, everything is supported. And when you do those lips, now everything's going to look complete and it's not going to be so done. The overfilled kind of crazy look is when you're not looking at the face of as a whole and you're treating very small individualized areas and sometimes overdoing it.
Absolutely. And we've seen it. I'm sure you guys, if you're listening to the podcast and you've ever seen somebody and thought, oh, they have so much, or their face looks overdone, it's probably because they were only doing their cheeks for 10 years or only doing their Botox, upper face Botox for 10 years. So it's definitely a whole, when you're doing these procedures, to look at your whole face, not just targeted here, targeted lips, all of those things.
And that a big key part of that too, and addressing the whole face, is you don't want to look like you're in your 30s or 40s, just the upper third. And then down here, you look like you're in your 60s or 70s. So, as much as everyone's afraid of filler, there's a part to it that will allow the whole face to age gracefully before you're ready for surgery. Because sometimes it does look a little bit weird if this looks immaculate and you're completely wrinkled and sagging down in the lower face. I really like to address everything.
Absolutely. And I think that also leads us into not just fillers and Botox, but the importance of taking care of your skin.
Amen. And I recommend that sometimes even over, don't just budget for another syringe of lip filler. Like put the money into the medical grade skincare. Three, down and easy, your vitamin C, your sunscreen every single day, and a retinol at night. You can make that affordable. You can use really good quality products. And the earlier that you start, the more you will thank yourself later. Adding in maybe again, microneedling, 3 treatments a year is usually what I recommend for my patients, unless we're working on something specific, maybe scarring or something else unrelated. But 3 treatments a year, you're gonna really thank yourself. You're gonna be banking that collagen for the future, and you're gonna age so much more naturally and gracefully.
I love me some microneedling. I
It's the best. I
love
think it's the
it.
unsung hero.
It really is. Microneedling, I've had multiple sessions throughout my life. I am actually in thinking I need to get myself a series of microneedling now. And
Hmm.
because it's the season. We're in the fall.
Yep.
And you guys, if you are thinking about lasers, peels, anything that has to do with your skin and protecting it from the sun, the fall is the time to get it done.
Yes.
Now's the time.
That is laser season, they call it.
Laser season, because you're not out in the sun all day swimming at the beach. You can hide, wear your hats, put your SPF on, and really let your skin recover from any type of procedure you do in the fall.
Exactly. Yep, that's perfect.
So let's talk about something a little controversial, which is you also put it on your form, and that is the PDGRF,
Yes,
PDGF.
yes. That is the hot button topic right now. Both sides, a lot of my lovely mentors are debating it online. I like to tell my patients all the time that I am not a cowboy in aesthetics. So we talked about the tried and true. You're sensing a trend here. I like to do things that are proven to be safe. I like things that my malpractice says an immediate yes to. I think a lot of people miss that sometimes. They add on treatments and kind of don't go into those legalities and ask, because it's actually very difficult for certain procedures to be covered by the malpractice. And while I am no means a PDGF hater, there have been things that have come out that the FDA explicitly says you cannot use this for injectable purposes. So I have personally never used it and I will not use it. I've seen beautiful results with it, and I've also seen really bad complications. And we don't know what the effects are long term. We don't know really a lot of things. And again, bottom line, FDA says no, and most malpractices won't cover it. So it's something that I gracefully just choose not to delve into at the time being. But I think that there will be more research and more evidence going forward in the future, and maybe it will be something down the line, but currently it's not something that I will choose to bring on into my practice.
So let's go into the details of it. What is it, and why did the FDA say no?
So you can use it topically. So that's allowed, but that's very different than using it injecting. So actually on the syringe for this one particular brand of product, it says not for injectable use. And that's kind of the hot ticket item where the FDA immediately said no. There's a lot of great things with the growth factors that are in it for healing, and they do use it very widely in medicine. So they've used it to heal wounds and other areas, and they've had great efficacy and very low risk. However, we really don't have those studies for the face. So, topically, different story. I think a lot of people are going to continue to use it for that, and that's completely fine. But the injectable component of that is where it's a little bit risque, if you will.
Risque, and we don't try too much risk around here. Stay with the tried and true.
Yes, that's for me at least.
So, with the topic of skin, tell our listeners, tell my girls, what are your favorite skin products?
So I used to use a lot of ZO and Skin Better Science. Those were kind of my wheelhouse. That was what we offered at the prior practice that I was at. There's definitely a few beautiful products that I love. Coming into my own practice and having to buy my own products and start with the skincare lines and all of that, there were a few things that I didn't like, very high purchase orders. And there's a lot of products. So, funny enough, starting my own practice, it became a lot harder to do my big, long 10-step skincare routine. And I kind of realized like this is why my patients don't want to do that either. And I realized it was a lot of products that you had to use. So there was a company called Pavis that I had tried many years ago. Actually, they only had one product at the time, but I loved it. I actually tried to bring it onto the practice that I was at prior, and it just kind of never fell into line. So I was like, you know what? I really loved their products. So I reached out, started trying the newer products that they have as well, and loved them. So right now they are my hero brand that I carry. They have four products. They have a cleanser, they have their daily, which is an SPF plus a million other things. So there's antioxidants, there's anti-pigment ingredients in there, anti-aging, moisturizers. It's your hero daytime product. Now it really stays, so you don't have to reapply it like a typical face SPF like you would need to. It's also mineral, which I really prefer more of a mineral sunscreen, just my preference. With that, you have to remove it almost like a waterproof makeup. So the cleanser that they have is gentle, but it does remove that and any of your waterproof makeup as well. So prior to that cleanser, I used to double cleanse, and now I don't have to with that. Then they have their pink one, which is their basically their hero other products. So I can use that post procedure. So I love to pair that with my microneedling. You're going to get better results faster and you're going to heal much quicker. So your downtime is going to be less. And it's wonderful. You can use it AM and PM, but I tell my girls, if we're on a budget, even myself, I use it just at night to kind of stretch things a little bit more. I love it. I noticed with that product, between your Botox time when you're not quite ready to retreat, but your lines are kind of coming back and you're like, I know it's almost time. I found that I can almost stretch my talks a little bit longer because it really helped to soften those residual lines that would start to come back sooner. So I'll stretch almost 4 to 5 months now when I'm consistently using this product. And then the last one that they have is their eye cream, which they were sold out of for a while, but I finally was able to get it in stock, and that's beautiful as well. So I love the Pavise line. Like we talked about earlier, it's your SPF, you need your antioxidants, whether that's vitamin C or something else, and a retinol. Not everybody needs moisturizer. You can kind of keep it simple. We don't necessarily have to have a 12-step routine, but there's nothing wrong with that either. I mean, I like to play with growth factors sometimes. I'm a skincare junkie, so I do like to experiment with different things. I'm looking into private label. There's a few other products I'm going to bring on, I think, myself, but really you can keep it pretty simple, especially when you're first starting out. I tell my girls, you need to work with something that you're going to be consistent with. Because if I sell you 12 products and you're not going to use them, you wasted your money. So you can start with 2 or 3, make sure you're going to use them, make sure you like them, and then you can kind of gradually add on from there.
Absolutely. I think that reminds me of something that I saw online, which was like, the question is, does this work? Does this product work? And the answer is, if any of these products will work if you use them consistently, if you
And that's the
actually use
key
them.
too. And you're not going to see it overnight, which is hard. But most of the time, it takes about 6 weeks at minimum to really see a change in the skin.
Yeah. I think for my ladies who are listening, my girls, if you're dabbling, you're like, I want to do something for myself, I want to start taking care of myself. Maybe you're considering surgery or you're considering something, you want to do something. I would say start with your skin. Start with a good skincare regimen. Start with taking care of your face, because our face is our identity. It's what, the
Mhm.
first thing people notice about us. And I think when we take care of our skin and we take care of our face, everything else kind of follows. It's like, okay, well, now my skin looks really great, and I'm more excited about taking time for myself, pouring into myself with my skincare, and I think it's the perfect gateway drug, honestly.
Absolutely. And I tell my patients, your skin is really what everybody sees when they look at you. So we can do all the injectables in the world, but if you're not taking care of your skin, it's not going to look good because you have to have that beautiful, healthy complexion to really let the injectables shine. So they go hand in hand. And I think skin is absolutely priority number one.
Absolutely. Oh, Julie, I've enjoyed having you on the show so much. I hate that we have such a limited time. I feel like the next time you come on, I'll have so many more things to talk to you about. But before I let you go, I want you to give my girls who are on their journey of becoming the woman of their dreams, what is your one tip or maybe two tips of helping them, pour back into themselves, get in love, fall back in love with who they are?
That's a tough one. I think you have to do the work, and you can't look to injectables or surgery or anything else if you're not going to look inward. And even sometimes, my patients will come in and they want something that I'm telling them no because they don't actually need it, and I have to get down to the root. And I'll usually find something, whether they're in a relationship that's failing, or they just lost a family member, or they lost a job, or whatever it is, there's something going on in their life and they're expecting me to fix it, and I can't. So if you don't take care of yourself first, the rest isn't going to work. But if you're doing the work and you are pouring into yourself and you're doing your self care, doing your workouts, your walks, whatever it is that you need to do to take care of yourself, and you combine it with the aesthetic medicine, you're going to be unstoppable and your confidence is going to be through the roof. And that's what it's about.
Oh my God, I love that. You definitely hit the nail on the head. I'm actually rereading this book called The Inner Work. I read it about 3 years ago while I was going through my journey, and it's again now I'm rereading it because I feel like I haven't read it in a while. I want to refresh on some of the things that I learned in that book, but definitely working on myself, on my inner inner Mavi and
Mm-hmm.
little Mavi has been such an eye-opening experience because before I did any inner work, I thought I was fine. It's like, there's nothing wrong with me. I'm perfectly normal. Normal just like everybody else. And it wasn't until I actually started to deep dive into, oh, is that why I do that? Like that makes so much sense. Oh, that's why these certain situations make me feel like this. And it
Mm-hmm.
really it started my journey of personal growth and becoming the best version of myself. These
That's what it's about.
I love it. I love it. Thank you so much for being on the show, Julie. I've really appreciated you. And if any of my girls want to come see you, how can they find you?
So you can find me on Instagram. My Instagram is Jules, Jewels, the letter X, aesthetics. And you can also find me on my website. It's going to be investinyourface.com.
Oh my God, I love that website name. That is so
Thank
good.
you.
And with that, you guys, I'll see y'all next week. Thanks for watching Big Butts No Lies podcast. I make every single episode with so much love for you, and I really hope you enjoy it. Don't forget to like, subscribe, and set your alarms for you to get notified when I release new episodes. And if you're on your plastic surgery journey and you don't know where to start, or you just want some guidance, contact me at mavi@bigbuttsnolies.com. Here.